Welcome, everybody, to On Crime and Punishment. This is a podcast brought to you by the Center for Criminological Research at the University of Alberta. In this episode of the podcast, Dr. Kevin Haggerty, one of the faculty members in the Department of Sociology at the University of Alberta, will be talking with Dr. Justin Tetrault and Rachel Xyminis-Chen about the experiences of BIPOC prisoners during the COVID-19 pandemic in Canada. Please remember to like this video on YouTube and subscribe to our YouTube channel. It's youtube.com/c/Center for Criminological Research. If you're listening to it as a podcast, you can subscribe to us on Google Podcasts, Apple Podcasts, and most other places that podcasts are found. And it's always helpful to give us a 5-star rating in the Apple Podcast app. That way, we get moved up in the algorithm. Enjoy the conversation.
Welcome to another installment of discussions that we've been having around the topic of COVID, prisons, incarceration, and these are sponsored by the University of Alberta, the Center for Criminological Research. And we're very, very lucky to have today Rachel Xyminis-Chen, I think I got that right, and Justin Tetrault. From the formerly from the University of Alberta, now at King's in Ontario. And we are, for those of you who are paying attention, this is the end of May in 2020. And thanks to everyone for watching, and thanks to Rachel and Justin for being available. I look forward to the discussion. I figured maybe just a good place to start would be just some background for folks who don't know you or don't know sort of your activities. So Rachel, why don't you just give a little bit of a summary of who you are and what you do?
So thank you, first of all, for having me. It's an honor. So my name is Rachel. I am the Director of Programs and Community Culture for Keep 6. Keep 6 is a nonprofit organization based in Toronto that works primarily with criminalized and marginalized groups, providing support and advocacy both during incarceration as well as post-incarceration, and really working to provide recidivism reduction programming and support.
Excellent. And Justin.
Yeah, thanks for hosting me, Kevin. I'm glad to be here. So I'm assistant professor of sociology at King's University College at Western in London, Ontario. I'm also senior researcher and project manager for the University of Alberta Prison Project. So I've been interviewing folks inside prisons alongside Kevin and other colleagues since, I guess, 2016 is when we started. Yep. And last thing that might be relevant to this discussion is I'm Manitoba or Red River Métis. My father was a child of the 60s scoop, which is, if you're not sure what the 60s scoop is, it's when the Canadian government forcibly removed indigenous kids from their families, placed them up for adoption as part of this effort to assimilate indigenous peoples into Euro-Canadian culture. So that happened to my dad, his brothers and sisters, or my aunts and uncles, separated into different foster homes across the country. And of course, this has kind of inspired my interest in indigenous issues in Canada. So I'll leave it at that.
Right. No, that's an interesting background. Rachel, do you have any more biography that you'd be interested in sharing?
So I guess for me, my journey started at the age of 16. I was a street involved youth. So with that, I had quite a few encounters with seeing those that I was close to coming in contact with the Canadian criminal justice system. I saw a lot of the barriers that were faced post-incarceration as well. And from that, I decided to pursue, start my own journey, first starting going to school as a paralegal, and then starting within the criminology and criminal justice program at Ryerson. And from there, I was blessed to have an opportunity to work with Keep 6, first just as assisting as a volunteer from the advocacy standpoint. I personally have supported many loved ones that are very close to me within the prison system. So it was something that was more of a passion for me. It was very personal for me. And through that work, not only with my own loved one struggles, but also seeing others, that's sort of what motivated me to take it a step further and get into where the field I am now.
Great, thank you very much. Are you currently Ryerson, or are you graduated?
No, so I'm not currently at Ryerson. I did take a bit of a break just for a little bit for a few personal reasons, but I'm going to be going back shortly.
Great, perfect. Maybe just turning to the sort of contemporary situation, sort of prisons, Canada, COVID. Maybe just, are there things to start with at an organizational level that I think people need to understand about the Canadian criminal justice and punishment system to ground our discussion, I guess? And maybe just Rachel, if you want to just take that up.
Yeah, for sure. So I think the first thing that a lot of individuals don't realize is the differentiation between the provincial and federal system. So with the provincial system, those are individuals that are either on remand, so currently awaiting trial, they have a matter before the courts, or they're individuals who've been sentenced to 2 years less a day. As opposed to the federal system. With federal, it's anyone who's been sentenced to anything 2 years plus a day, and they are governed by CSC, whereas on the provincial standpoint, each province themselves have their own solicitor generals or governing bodies for them.
I'll just pause there for some of our readers, listeners, not readers, who might not know. CSC is Correctional Service of Canada. So this is the acronyms we get used to.
Yes, so that would be the main difference between the two. As such, with federal system, because they're individuals that are going to be having a slightly more tenured sentence through time, there is a little bit more structure, I guess you could say, in their daily routine, as opposed to from a provincial standpoint, because there is quite a bit of turnover. There can be, it can be, I guess, for lack of a better word, a little more disorganized, if that's the right terminology to use.
Yeah. Justin, did you want to add anything to clarify that? Because it is a vital thing that people don't understand.
I don't have too much to add to that. I think we can get into more specifics as we maybe go along with the other questions. So.
Yeah, and I think Rachel might have said this, that just at the provincial level, there tends to be much less programming and just much less support than in the federal system. I guess we're talking specifically about racial issues in prison. Maybe the obvious place to start, both in Canada, in the United States, gets a lot of attention around this issue about overrepresentation of different racialized groups and other groups as well. Maybe we just start with that in terms of the picture in Canada, in terms of where we sit and what we know about sort of these kind of overrepresentational issues. Justin, do you want to chime in on that?
Sure. My expertise falls more into indigenous issues around there, so I can kind of paint that picture. And just to give you a sense of what is going on, statistically, indigenous adults account for roughly 30% of admissions to prison, despite only representing 5% of the Canadian adult population. Overrepresentation even worse for indigenous women, who account for 43% of female admissions nationally. As part of our research on the project, we interviewed people inside of a women's prison in Western Canada, and over 70% of the women in that prison were indigenous, which is astounding. One more stat I have here from 2003 to 2013, the incarceration rates for people of color, so including Black, Indigenous, and people of color, rose by 75%. So in short, incarceration rates for people of color, Indigenous peoples, they are bad and they're not improving. So why is it that Indigenous peoples are so radically overrepresented in prison? Well, it's kind of hard to reduce this to kind of a soundbite, but I'll try. In short, we are still dealing with the legacy of colonization in Canada, racist or assimilationist government policies from residential schools to the 60s scoops. They have devastated Indigenous communities where Indigenous peoples, they're disproportionately poor, disproportionately struggling with mental and physical health. Roughly half of indigenous children live in poverty. You may have also heard of the term intergenerational trauma, where traumatic events related to colonialism, such as abuse in residential schools or being forcibly separated from one's family, that can lead to post-traumatic stress disorder that can be transmitted to subsequent generations of indigenous peoples. So in short, if you're living in impoverished conditions, maybe you're struggling with trauma, people sometimes turn to drug use. Sometimes people use the criminal economy as a means to get by if there aren't many opportunities or resources for them to move up in society. Some people turn to gangs as a source of income and also belonging. And as we know, the criminal justice system is designed to police street crime. Police spend most of their time in impoverished communities. So to kind of summarize why we see so many indigenous peoples in prison is the culmination of all the things I just described. Colonization has led to trauma and poverty for many people. Those things lead to financial and personal struggles, which can lead to criminalized actions. And the criminal justice system is concentrated in poor communities. The last thing to add here is that which I think is important, is that more police and more prisons is not the solution to this issue. These communities need resources, they need opportunities, and frankly, they also need political power. Right now, the criminal justice system seems to just be reacting to symptoms of poverty and colonization. So what we need is not a criminal justice response, but a robust multi-institutional response, including education, health, et cetera, that gets directly at the root cause of the problem, which is poverty itself and the lack of political power for indigenous people. So that's kind of just a very condensed crash course in mass incarceration of indigenous peoples in Canada. So
yeah, and it's one of those things that Canadians, there can be as kind of a self-satisfied, glancing at the United States around sort of the mass incarceration, particularly of Black and Latino people. But in Canada, for certain populations, the picture is dramatically worse. And there's just, I think, some ignorance. No, not some. There's considerable ignorance around this amongst Canadian citizens. Rachel, did you want to add some sort of round out some of that picture?
So I think Justin's done a really good job of providing a good overview of what that looks like. Similar when we look at the Black community, Black Canadians make up about 4% of the Canadian population. However, when we look at the prison populations, it's close to 10% of, they make up close to 10% of the actual prison population. And so again, we're seeing the overrepresentation. Specifically, when we look at it even a little bit further, I know a colleague of mine had done a study recently, and one of the things that she had noticed was for a lot of the pre-apprenticeship programs that were being offered to individuals within the institutions, a lot of the Black and indigenous folks that were in the institutions were either in ranges that were either considered lockdown ranges or mental health units, where they didn't have access to similar programs or resources that those that had access to, being on a work range or had privileges, had access to. And it really spoke to, again, that interplay of systemic barriers, as Justin mentioned. When we look at the education system, healthcare system, financial literacy, economics, they all play a part within the actual overall incarceration system in terms of how they're all interconnected. And as just mentioned, a lot of that comes down to a lot of individuals within marginalized communities are really just trying to provide for themselves and their loved ones. But due to a lack of community resources, due to a lack of supports, and being in impoverished areas where they're consistently policed, their ability to move forward is quite limited. And that, unfortunately, is where we see this cycle that has, for many, become generational trauma.
Yeah, I mean, we were talking about this in a previous conversation. I mean, there are lots of, there's always lots of concerns and issues within any prison or incarceration setting, from violence, lack of services, programming, etc. But I think sometimes we forget those issues, because of these overrepresentation issues, are always racial issues, and we tend to not treat them that way. We tend to kind of, whitewash that kind of racial kind of dynamic to it. just given the topic of the podcast, maybe we should sort of move to a little discussion about sort of COVID related issues. Maybe just at the biggest level the highest level for people who aren't familiar with what's been going on in prisons because they've been paying attention to their own lives and own priorities. Maybe just a quick summary of how officials have responded to the COVID situation in Canada. What's happened? What's gone on? What have been the challenges? Either one of you would like to jump in on that?
Rachel, you can probably more familiar than I am. Actually.
It's a big question. I know. Sorry.
I mean, as we know, like COVID's affected us quite drastically on the outside, even more so on the inside. When we look at prison systems in general, where we already see overpopulation, we see poor ventilation, we see very close quarters. Even prior to COVID, it was very common that if one individual or a few individuals got sick on a range, the entire range would get sick very shortly after it. That's been heightened even more with COVID specifically. We've seen there was a huge call for action when it came to PPE, cleaning supplies. These were items that were very limited to inmates. Cleaning supplies for reasons of inmates potentially be using them for the wrong reasons was majority of the response that we had received from officials, but also smaller things like PPE in general. We saw for some institutions that did have outbreaks, they had to transfer quite a few inmates from one institution to another institution because they weren't able to properly provide quarantine measurements or safe measures for these individuals. And along with that, we've seen the effects on inmates' mental health, as well as the effects with regards to their programming, in the sense that with there being these restrictions, visitation has been affected. So having the normal familial support that they may have been accustomed to, increased lockdowns, with that meaning decreased phone time, communication with families. These have all been factors that have affected individuals during the last year or so, and have been a concern for many of the advocates that we've seen have been making a call for action.
Yeah, and if I can just build on some of the things Rachel said, I mean, canceled programming is, generally speaking, one of the most devastating effects of the pandemic on prisons, maybe outside of the harms of the virus itself. With our research kind of speaking to folks inside, boredom was often cited as just one of the worst parts about being in prison. There's just not much to do. And this boredom can lead to increased substance abuse, stress, violence, if your mind is not occupied, or if you don't have any activities or places to go. Also, prisoners are, many of them are trying to finish school, which for some people, if those classes are canceled, that can affect whether or not they get a job when they're released. Church services are canceled in many institutions as well. Gym activity, also canceled in many institutions. And yeah, of course, Rachel mentioned visitation. People can't see their family members, at least not in person. I think Rachel also mentioned increased lockdown times, which I also wrote down in my notes here. When you're in your prison, you have your cell, and typically you're let out of your cell into larger spaces where you can shower and interact with people, and more importantly, make phone calls. And with the increased lockdown times, there's fewer opportunities to talk to loved ones, less showers, among other things. So obviously all of these things culminate in poorer mental health all around. So yeah, we'll kind of leave it at that.
Yeah, I mean, prison is a stressful place to start with. And this is just layering on top. I had students who were, when the COVID first hit, healthy students in the community who are extremely distraught in very good situations. I mean, you layer on being away from your family and all of these other things, it becomes kind of devastating. What about particular specific things that are related to sort of Black or indigenous communities for people who are incarcerated? Has this had distinctive or particular consequences? Maybe I'll just start with Justin.
Yeah, so if we're speaking kind of generally, in Canada, Indigenous peoples have shorter life expectancies and are more likely to experience comorbid health conditions at younger ages, such as respiratory illnesses, diabetes, which in the context of COVID-19 increases a person's vulnerability to infections, and infections can become complicated. Researchers have also shown that poor health among Indigenous peoples is directly linked to poverty and is a result of colonization. Some communities or reserves, for instance, do not have access to clean drinking water. Some communities are affected by poor housing and overcrowding, which can lead to faster spread of disease. So I'm sorry if you hear the sirens in the background. I'm living downtown. So COVID-19 poses a higher risk for many Indigenous peoples generally, and this can be even worse in the prison system, where Indigenous prisoners just have limited access to healthcare, sometimes medications. And of course, prisons also just house some of the most vulnerable people in society who often struggle with mental and physical health. So in short, you have a very you have very vulnerable populations concentrated in a relatively small space, with lots of people interacting, people coming in and out, the prison, right? And a virus obviously can have devastating impacts in that kind of setting. So,
yeah. Rachel, thinking again about the health issues and how this might affect different racialized communities, did you have any other thoughts or comments?
I think Justin's done a pretty good job of summarizing it quite well. But I mean, with regards to the one thing I noticed is there was definitely paranoia within the institutions themselves. And as we know, um, when it comes to healthcare within the institutions, um, the lack of healthcare or access to healthcare is very limited. And so, for many of these individuals, especially Black and Indigenous folk, there's also the mistrust when it comes to healthcare. And I believe that's something we're going to talk about a little bit more shortly. But for many of these individuals, because they're in such close quarters, because they're now sitting in their cells and watching the news 24/7, and all they're seeing is COVID-19, and they're not able to see their families, it had quite an impact on their mental health. And without having the programs necessary for them, we were seeing a lot of individuals that were having mental breakdowns. And that's something that we saw with individuals on the outside, even more so again on the inside. As you mentioned before, prison itself is already a very stressful place. So without having those supports available to them, we saw a lot of the mental health concerns heightened.
Yeah, and just picking up on something you just said, I mean, it is May 2021. A part of I think the defining moment right now is the vaccine rollout is ongoing. Things appear to be at least turning a corner. I mean, do you get any sense, maybe Rachel, any sense of how this might be unfolding or the challenges that are particular to incarceration?
So within the Black community itself, there's already skepticism when it comes to just the racial disparities in the medical industry. If we think back to just history as a whole, in terms of medical forced experiments on Black enslaved folks, the sterilization of women, when we think back to the infamous syphilis study, a lot of individuals have every right to be skeptical when it comes to the medical industry as a whole, because of the racial disparities and the discrimination that there has been a history of over the course of the last however many years. And so now with the vaccine rollout, with there already being a mistrust within the prison system as a whole, as it stands, there's been many individuals who've been very skeptical when it comes to, do I take the vaccine? A lot of individuals also being inside aren't properly informed. They're very limited in terms of their access to information. So what they're hearing is either from what they've seen on the news, or if they are able to make a phone call home or have a video visit, and what their family has been able to tell them. That's pretty much it when it comes to really being able to make a properly informed decision.
Justin, did you have any other insights or comments about the vaccine situation?
I don't have too much to add to what Rachel said. Within the Indigenous community, I can't say too much about it since we don't really know how widespread vaccine hesitancy is.
Right.
It doesn't seem to be a problem to my knowledge, as there are many Indigenous communities that are vaccinating their people. There have been reports of some hesitancy that seem to stem from, to kind of build on what Rachel said, just general distrust of the Canadian government by Indigenous peoples, considering the violent history there. Some have observed that, like, the Trudeau government, for instance, hasn't cared about Indigenous health related to clean drinking water. So why are they suddenly caring about our health now? That kind of attitude. But from what I know, Indigenous skepticism of government does not necessarily translate into not getting the vaccine or vaccine hesitancy. It doesn't seem to be a widespread issue. And in prisons, I can't really speak to that very much because we don't have too much of a reason to believe this is happening in prisons as well, to my knowledge anyway. So yeah, that's about it.
Yeah, I mean, one of the things that motivates the question is, for people who are viewing this, Canada has a very small research community of criminologists, and we can't even begin to cover all of the possible topics. And I have been paying attention to the situation around a whole other issue around the vaccine hesitancy, is vaccine hesitancy in the United States around correctional officers. And this is very much a red state, blue state kind of thing, which again, we don't know. I mean, my sense is we don't know what's going on in Canada, but if correctional officers are not being vaccinated, that brings a whole other series of risks into the prison to other officers and incarcerated folks, et cetera. So, you know, it's something that I think we don't know anything about at the moment, unless there's some report that I have not seen. So moving again, I think both of you have mentioned this, but I wanted to sort of return to it because I think it's so important. And that's sort of canceled programming, and particularly canceled programming affects everyone. But my sense is that it affects some groups in different ways for different reasons. So maybe Justin, you maybe want to expand on that.
Yeah, it's kind of the general situation where, like for Indigenous prisoners, things are just kind of exacerbated. So Indigenous peoples, especially Indigenous women, are more likely to struggle with mental health, such as intergenerational trauma, and accessing adequate mental health care during the pandemic. We kind of already touched on this. It's extremely difficult, and perhaps not possible for some prisoners. Many prisons also have regular elders visit the institution, and we know that this has been stopped in some institutions due to the pandemic. Smudging, cultural resources, that kind of thing. A lot of these things have been put on hold or canceled for the moment, and religious resources and all that. So regarding specific programming, I don't have too much more else to say than things have just been put on hold, unfortunately.
Rachel, is that roughly the same picture in the Black or other communities that you're aware of, or are there other nuances here?
I can speak to recent events where within some of the provincial institutions in Ontario, there was an effort made to incorporate more Black programming. We saw that there was an opportunity where there wasn't much culturally relevant programming, and that went from actual programs itself to even even literature within the library itself. And so there was a initiative that was put forward. We had two initiatives that were put forward. One was called 1,000 Black Books for Inmates, where the community came together and collected and donated 1,000 books written by Black authors, speaking to many of the issues that those within the Black community face, that were written specifically for those within the Black community. And they were donated to a particular provincial institution. And those books were received, they were put into the library. At some particular point in time, those books were then removed from the library. And for a lot of the individuals who had the opportunity to have some of those books, it was almost as if you were taking candy from a baby, because they had just received Many individuals were asking for specific books that they weren't able to have access to, and they had just received them, and now they had those taken away. The same thing went forward in December, where we had members of the community, we'd received approval where members of the community were able to donate black soap and shea butter to the guys within the institution as well for Kwanzaa. And a similar thing happened where during one of the institutional searches, the items were again taken away and confiscated as quote unquote contraband, only to be realized later after the fact that they were approved and they had received that exception. So from where we stand currently, it's only fed more of that mistrust within the institution, especially as many felt that we were starting to make a little bit of headway. We were starting to have a little bit of reform in terms of really just providing programming that was going to be more specific to the guys within that particular institution. And that all kind of came to a stop. But during that time when that programming was being offered, when we had 3 individuals who previously had been in prison, had come out, started their own businesses, and were now mentoring a lot of the guys in there, we had a really great engagement, and we had a very, very good response. And some of the individuals that were attending those programs are now out on the outside and looking to create their own mentorships and their own youth development programs. So we saw the successes that came from having something that was culturally relevant, having a programming where these guys were able to relate to somebody that looked like them, who had similar backgrounds. And our hope now is that eventually we'll be able to get back to that place again. But again, that involves the institutions being able to work with the organizations that are really trying to put this together.
That book, your story about sort of confiscating that books, I guess, as an academic, that's always disturbing. We love our books. Do you know what justification was given for this? And I mean, I guess, if you know something about prison, and we mentioned this before, how profoundly boring it can be, and books can be gold. So, I mean, was there any accounting for this?
So the individual who works within that particular institution, who had worked to receive the approval to have these books as well as these items received, was told that they were worried that those particular books might incite violence or potential rioting, was the I guess excuse that she received. And it's sad. It's very sad because for many of these guys, it was their first time being able to read something from a Black author in a very long time. A lot of the books do speak on resilience, and for many of them, it was sort of that additional motivation that they need, right? As we said, it can be boring, it can be stressful. Many individuals can be depressed being inside. But unfortunately, at that particular time, they were no longer approved and allowed.
Yeah. So when we were talking before, Justin, you were talking about some of the particular issues around sort of transportation for some of the incarcerated folks or people post-incarceration. Maybe you can give a sense of what you were flagging there.
Oh, yeah. Yeah, just quickly, I mean, Indigenous peoples do have special requirements when it comes to all Indigenous peoples, but release from prison. The Yellowhead Institute is doing really good research on this. Reserves are essentially under emergency shutdown, where they have specialized rules of who is let in and out of the reserves, and rules around vaccination and that kind of thing. So in short, when Indigenous peoples are released, there may be certain circumstances where they require like special conditions of release for the reserve that's under lockdown, or transportation, because many folks live outside of cities and that kind of thing. So it's just about being conscious of the situation in Indigenous communities and being aware of how to best safely release people back into the communities that satisfy both the person and the community. So yeah, that's about it.
Yeah, and I think this, I mean, just to make the point, this was also this is a generic issue. This is an ongoing issue in these communities, but it also, for at least for a while, my sense is it became fairly acute, because one of the responses in several jurisdictions was to attempt a greater decarceration of the population. So suddenly you had more people needing transportation, more people needing, release plans, or if they've got any release plans. So I think this isn't just a generic day-to-day issue. It became particularly pronounced kind of, months ago.
Yeah, the logistics are more complicated. Yeah.
Maybe just transitioning to sort of one of the other things, and this goes back to the criminological issue, trying to figure out what's going on inside. You both work on these topics. Have you had any sense in terms of the ability to get information, what we're missing, what we're lacking? Rachel, do you want to sort of speak to this?
So many of the accounts that we've received are from individuals who are calling from the inside.
Right.
Now, that being said, because we're getting personal accounts, that's one thing. However, sometimes we have found that there can be some inconsistencies when we look at the communication that's provided by the institution to the general public in comparison to what the inmates on the inside are receiving as well. And so what we can go off is really only the personal accounts that we are hearing from those that are calling in. You can go on the website, for example, CSC, you can see the numbers that they put out there. But we've had cases where there have been institutions that on the site have shown no cases, whereas inmates have been able to read communications that they've received personally that state otherwise. And so it really, again, just plays into that part of just the inconsistencies when it comes to communication, the lack of trust. And again, we can only see we only know what we hear. We're not able to go into the institutions themselves right now due to the restrictions. So other than the firsthand accounts, we're limited in terms of where we're getting a lot of that data from.
Has anyone, I have not heard it, has anyone heard any rumors as to when they might open up? I mean, there's smatterings of them opening up in certain ways across the country, but has there been any kind of pronouncements of like at what stage or what timeline they would be opened up on a more regular basis? And this is a major concern. So I'm not sure. I haven't heard anything.
I personally had a wife of someone that's on the inside who had sent me an email she'd received from the Visitation department where her partner was at. And it didn't give any specific details, but it was the first time that they've gotten communication to state that the institution was now reviewing their protocols and was looking to ease some of the restrictions in place. But there wasn't anything specifically to state or to give an idea as to when, but it was the first time since summer basically that they had made the mention that they are reviewing what those restrictions look like and looking to see where they could potentially ease some of those restrictions.
So some of the dynamics going on in prison, we get sort of news releases, etc. Have we been able to discern how some of these patterns are connected to racial populations? Are they are the data sort of race-based, I guess? Have they been able to sort of provide those types of data?
So, I mean, I've had this conversation with Justin a few times, just in regards to the lack, excuse me, of race-based data within Canada in comparison to our counterparts in the US. And so with that, because again, we're not able to get into the institutions, a lot of the data is really based on what we're hearing from loved ones, from family members. And if we have the privilege of being able to speak to someone on the inside, then their own personal accounts again. I'm sure Justin could probably touch on it a little bit more as he's been doing a lot of that research. But from my own experience, that's a huge opportunity just in terms of accumulating race-based data within Canada. It's not something that we've done a very good job of currently, and I'm hoping we can change that, especially when we see what that data could assist in terms of making informed decisions or recommendations.
Yeah, to kind of build on what Rachel said, I mean, there's even less data on, I think, Black Canadians. For Indigenous peoples, there's kind of the stereotype that Indigenous peoples are just over-researched, or that Indigenous issues have been researched to death. This is not the case. Generally speaking, with race, the government of Canada, for instance, does not collect race-based data in many areas of society, such as police-reported crime statistics, the areas of employment, housing, education. There's been a call recently with Bill C-230 to have the government gather race-based statistics relating to health, for instance, so we can better identify these kinds of things like the links between race and poverty, also environmental hazards and health outcomes. And a couple of scholars, Wusu Bempa and Bernard, recently outlined this in the National Post article earlier this year. So I suggest people check that out. And so we still have government statistics and reports and academic studies kind of highlighting Indigenous issues, but there's still remarkably little research that works, let's say, like with Indigenous peoples or communities, or that directly works to improve the lives of Indigenous peoples, or what is often referred to as a decolonial research. That kind of work is severely lacking, and I would like to see, more collaborative research with Indigenous peoples, and of course, we need this race-based data as well.
Maybe just stepping back from some of the particulars, where this has been over a year now. Looking back, what do you think that Canadian correction, whether that could be at the federal level, the provincial level, community sort of sanctions, what do you think they could have or should have done differently? Again, this is in retrospect, but I think we learn lessons this way. So, Rachel, do you want to think about this a bit?
I think, in my opinion, there could have been more room for looking at decarceration, or more, further decarceration. We've seen multiple halfway houses within Ontario who have actually extended month-long passes to their residents, just to minimize the amount of contact within the halfway houses themselves. And with that, these individuals were able to go home. They were able to have the family support. We had quite a few individuals who had contacted us to reach out for some of the post-incarceration programming that we offer. And many of them were able to actually seek employment during that time that they had been sent home. I think within the prison system itself, there could have been more effort to look at the decarceration of individuals with disabilities, those that may have been elderly, those with autoimmune diseases. There would have been more of an opportunity there. And also just from a organizational perspective, in terms of a lot of inmates we saw were bounced around or transferred from institution to institution, again, due to the lack of PPE and cleaning supplies and space in terms of being able to quarantine effectively. So I think they needed to strategize a little bit better. That being said, when COVID hit, we all were forced to pivot and scramble and try to strategize and find how we were able to function in a world that we weren't accustomed to. But I definitely felt that there could have been a bit more strategy that could have been done effectively.
Yeah, and to connect that to what we just said, I mean, it would have been interesting and probably revealing if we could have known what the racial profile of the people who were decarcerated and weren't decarcerated were. It would have probably been, well, interesting. So yeah, connecting these ideas. Justin, what do you think about sort of what might have been done differently?
Yeah, I really don't have too much to add. Rachel, I think, covered most of it. I think decarceration is easily the big one, and you outlined that very well. It would have been nice also to have a more kind of swift or fluid transition to kind of virtual programming and visitation. It seemed It's hard to know because we're still going through this, but it seems from our kind of preliminary research, talking to people whose loved ones are inside prison, that it was kind of a mess and not very well introduced or smoothly introduced. So like you could do like elder visits, programming and kind of Zoom style lectures in rooms where people could maybe socially distance if that's possible. So, and, you know, it's different per institution, but I think decarceration, the two big things that are both obvious and doable from the beginning were, I think, decarceration and some kind of virtual programming or visitation. I think those are two kind of big ones that could have been right off the bat. Let's do this right now and make sure it runs smoothly.
And to Rachel again, I mean, again, reflecting big picture, what do you think the big picture lessons that either citizens or politicians might have taken away from what we've seen over the last year?
Well, when we look at the costs that have been incurred with supporting inmates again throughout the pandemic, and decarceration could have definitely been a solution, but it definitely helps us to see or strive to look at alternative resources and alternative solutions in general, in terms of how we're able to properly support. And I think that's something that Justin really touched on in terms of like providing virtual programming for one. How do we look at what alternative resources we can provide to ensure that we're still, we are able to rehabilitate, I should say, those that are in the system? How do we promote that recidivism reduction? Because right now, sometimes individuals fail, I feel like sometimes individuals fail to realize that despite whatever wrongdoing, they are still human, and we need to be able to treat them with that respect. And being with the increased lockdowns, with less human contact, this is now sort of promoted an atmosphere where we've seen those mental health concerns, where we've seen individuals who've now become more isolated. And these are the individuals who at some point need to step out into society and may not necessarily be able to properly reintegrate when they've been limited in those resources. And so I think that's something from the politicians need to really look at in terms of what are the alternative resources, what are the ways in which we can or they can be able to ensure that inmates are receiving the support that they need, even during a pandemic, even when we might be limited or we may have restrictions in place.
Okay, that's great. Justin, again, on this theme of kind of big lessons, were there other things that maybe Rachel didn't touch on that you've been thinking of?
Yeah, I guess, well, actually, Kevin, you mentioned this kind of briefly, but regarding race, I mean, the pandemic shows why race-based statistics and research matter. We know that Black Canadians and Indigenous peoples will be more at risk or vulnerable to COVID-19, and this requires race-conscious responses that respond to the most marginalized groups first. We did see some of this with the pandemic response where, for example, Indigenous peoples, I think Black Canadians as well, could get their vaccine before other groups due to the vulnerabilities we kind of discussed already. But there was also a lot of pushback by some of the Canadian public to that, who don't appear to understand why Indigenous peoples and Black Canadians were getting their shots first. And this response was, the response was kind of like, well, we should take a so-called colorblind approach where we just ignore race, which they think means treating everyone equally. But in reality, being racially colorblind pretends that we all start on an even playing field when all of the evidence and social science suggests that Indigenous peoples and Black Canadians, due to Canada's colonial history, far more likely to be disadvantaged and therefore vulnerable to COVID-19. So the thing I would just kind of add as like a lesson here regarding, like a big lesson to be learned is that we need more education around race issues in this country. We have to stop pretending that Canada is like this multicultural utopia that has conquered racism. And people need to, I think, be more aware of how history has affected us into the present and how that affects life chances. and with things including health and COVID-19 vulnerabilities.
Yeah, that was great. Thank you. I guess this is a question for criminologists and activists. I mean, we start from knowing certain things about incarceration and marginalized groups. What do you think the COVID situation affirmed? You know, just drove home, like, okay, this just affirms something that we already knew and just provides further evidence. Were there anything like that sort of comes out of this? Either one of you, if this makes sense, if my question makes sense to you.
I guess I can go first with criminal. I mean, it's just, I feel like I'm being a little repetitive here, but the pandemic confirms, I think, a lot of things that sociologists and criminologists have known. It confirms that we need, again, more race-based data and education to better respond to people's needs. It confirms that health and race are intimately connected and tied again to colonial history. Regarding prisons, it confirms that prison programming is extremely valuable or necessary to mental health. I'm assuming most criminologists would agree with that. And also the foil to that the pandemic also confirms that prison lockdowns, where you're not let out of your cell, also just general isolation from family members, the increased use of solitary confinement to isolate prisoners who test positive, these things are damaging to mental health. So the pandemic has like shored up issues that we've known about for probably decades, many of them. And I guess lastly, this development also just highlights how minimizing prison use and decarceration are desirable options. We need, Rachel touched on this already, but we need more alternatives to incarceration.
Rachel, were there things that you wanted to add in terms of what this affirms?
I think Justin's pretty much summed it up.
You guys are a good team.
I think if anything, the only other thing that I would really reiterate to is also the supports, the community and family supports. We saw how impactful and necessary those are, and when those are taken away, what the effects of those are for individuals within the inside when they're no longer able to call as regularly, or they haven't seen their family or had a PFV, private family visit, or a regular visitation in over a year. The strain that puts on the family unit. And for many individuals, when they are coming out, one of the things their POs do is their PO typically likes to do a community assessment of the family. But in a time when contact has been limited, when visitation has been limited, that strain can have an impact on one's support when they're being released. And so really just seeing that really just reiterated the necessity of having a strong family unit and where those support systems come into place.
Yeah, it's a vital issue, and in fact, I think the next I know the next podcast we're going to be recording is specifically on experiences of loved ones, COVID, etc. So yeah, we will be paying more attention to this. I guess the flip side of the question I just asked if there were things that kind of that were affirmed. Are there things? The flip side is, are there things that we learned or that challenged our assumptions that COVID has taught us or brought to the fore that maybe we hadn't anticipated? Justin, do you want to think about that?
Things that we haven't anticipated. I guess I just have a couple things. First, I guess we kind of touched on this. Decarceration is super important, but it's also more complicated than we tend to think. Releasing someone back into the community. It can be logistically challenging, which I touched on a few minutes ago. So for example, with our research in Western Canadian prisons, our findings show that some prisoners do not want to leave prison in some cases. This could be because they're homeless, they don't have anywhere to go. It could be because they don't want to go back to an abusive household where they perhaps experience physical or sexual violence. So what do we do in those situations? This requires developing resources or institutions that can help with de-incarceration. So suggesting that we kind of just simply release everyone, let's say we just did it today, that does not really do much for many people who would hypothetically be released? Where do these people go? Are they safe? Do they have financial support? How do they get around or travel? Decarceration requires a really robust and a really thoughtful institutional response that extends far beyond the criminal justice system. So put it another way, decarceration is never just about prisons. It requires organizations putting in work to help these people. And our society is just not equipped to do that right now. And we need to make it equipped to do that. The second thing, I guess, that I want to add is about prison programming. With this kind of defund the police narrative, there's also calls to defund prisons. And I kind of urge academics and activists to be careful with their language here, because sometimes what happens with prison budget cuts is that programming is the first thing to go. And programming is extremely valuable to people inside. So if we're going to shrink the prison system, which I completely support, we need to be clear that as we do that, programming stays. And I would argue not just stays, but is improved and also well-funded. And I think it is possible to minimize prison use while maximizing and funding good prison programming as we shrink the system. So those are the two kind of thing, I think, important points to take away from this discussion or the pandemic.
Rachel, did you have any thoughts about things that maybe were surprising, or the things that we learned that maybe that challenged what we knew?
To Justin's point, I had an experience where I had someone who was recently released and had run into some dental issues, and he wasn't able to cover the costs for the dental work he required. And I remember that phone call very vividly, where he called me and he said, I want to go back to prison, because at least there they'll be able to cover my costs, because I can't afford it. I can't eat right now because of the pain. I'm ready to go back to prison. And that impacted me and moved me so greatly, because in my mind, the first thing would be, why would you understand? Like Justin said, some individuals may be facing various circumstances where coming out may not necessarily be the quote unquote best option for them. And so it's really about organizations working together. And that was one thing that I found was, as opposed to different organizations or institutions working separately, there's a need for collaboration and pooling our resources together for the greater good. If we're all working for a similar demographic, how can we be sure that we're able to pool our resources together and ensure that we're providing a full wraparound level of care for these individuals, so that when they are released, there is no reason to think, I want to go back to prison. And that was something that shook me a little bit, but it also challenged me, where it's motivated me to start having that conversation with the various organizations within the city as to how do we work together to combat this.
Yeah, I mean, just sort of personally, this was one, your story about the gentleman in the teeth. This was one of the recurrent findings of our larger project, the research out west, in terms of, that things can be so bad for people in the community that sometimes the tragedy is that they will say they kind of prefer to be in prison, and that's absolutely nothing that's good. That's absolutely nothing that says prison is good. It's the tragedy of the failure on the outside. And for people who are interested, our colleague and collaborator Sandra Bisarius has a great TED talk kind of about this kind of issue. Just looking to the future maybe just go to Justin again. What do you think comes next, sort of in the short to medium term around this?
I think many academics and activists are maybe anticipating that the COVID-19 pandemic has been kind of an eye-opener for society. In other words, it has kind of revealed a lot of the, you could say, ugliness and failures of how society is currently organized, where people are increasingly realizing, perhaps, that, well, maybe it's institutions that have failed people, maybe society needs some structural adjustments. And in the middle of this, we've also got the George Floyd protests, which are very significant, as we all know. So my sense is that there is an appetite for social change, kind of speaking generally. I'm going to be optimistic here. I think you have to be sometimes. I think there's a growing appetite for social change and more opportunities for experts and activists to meaningfully affect change in the criminal justice system, and ideally make the criminal justice system a less prominent feature of our society. So I'm going to be an optimist today and assume and hope that that's what's coming next.
Rachel, do you want to look to the future in any way?
I think now, because there's been such a huge call for diversity and inclusivity, we're seeing where institutions are now being forced to change and look at ways in which they can reform or change certain policies. I think for a very long time, institutions were in that old school mentality of things only worked a certain way. And they weren't necessarily looking at possible solutions or alternatives. And now, because there's been such a call for action, because there's now been so much attention put to institutions, to Black Lives Matter, to indigenous folks, now the spotlight's been is shining on them, and now they're forced to make those changes. And so I'd say in the last 6 months, the amount of meetings and calls that I've been in with individuals I'd never think to sit at the table with individuals from regional and directors who are reaching out to say, tell us more about what you're doing. Let's see if we can align. Let's see how this can work. It does provide me with some optimism in terms of potentially seeing some levels of reform. And again, that's me being in a perfect world, we would see that. I do have my certain levels of doubts, but I am very hopeful that with this call to action and with the attention that's being provided now, we can at least see some change, which is better than none.
Just on your point about tell us what you're doing, maybe just a good way to close is just to invite each of you to tell us contemporary projects or initiatives that you're interested in, engaged in, would look forward to being involved in the future. Would be, I think, a neat way to wrap up. So Rachel, what do you want to start?
Yeah, so we've actually just launched a program called Gangs for Tuition within the GTA. And that program is designed as a recidivism reduction program for individuals post-incarceration, really to work on identifying individuals' current skill sets. I've found many times when I've talked to various individuals that are incarcerated, they'll say, well, I've never worked a day in my life. I don't have any skill sets. They don't know what a transferable skill is. And then when we kind of hone in on terms of what they were doing before they went to prison and identify how whatever it was that they were doing, in a way, they were already working to a certain degree. Now, how do we use those skills as transferable skills, but use them in a more positive light? And when I say that, for example, we had an individual who had been a drug dealer prior to. And the breakdown in terms of how I worded it to him was, during that time, how did you, quote unquote, market your product? How did you gain your clientele? What was your process in that regard? Now, it wasn't for the right, it was obviously not for legal reasons, but now those same skill sets, how do we use that for marketing your business in which you want to do now? Right. And once you start to position it in that light, you start to see that light bulb go off in terms of like, oh, I can do this.
Right.
And that's where that self-doubt starts to diminish, because many of them, I've never worked a day in my life, so I don't know what that looks like, and I'm afraid to make those steps. And so with this program, alongside another program that we have, which is called TRAP, Transition Recidivism Action Plan, where it uses authentic mentors who've gone through the system, who've been in and out of jail for years, but who've now come out and are successful paralegals and entrepreneurs. It shows them that it is possible to overcome those barriers, and really just provide them with that level of mentorship, so that those that are coming out have that support as they go on their own journey.
So that's great. Justin, so what are you working on or looking towards?
I guess I can just speak on stuff related to the topics we discussed today. So, I mean, generally speaking, I teach on this topic every year. I teach a class called Race, Racism, and Crime, which covers mass incarceration of Indigenous peoples, the experiences of Black Canadians. We also touch on the US. I'm hosting a learning series next week at Meskwakis Cultural College, predominantly an Indigenous institution. We're doing a 4-lecture learning series on Canadian prisons. I guess, yeah, that's about it. And also, I am CSC, the Services of Canada, reached out to me about updating their so essentially when you get hired to CSC, if you're a staff, you have to take a course called Introduction to Indigenous Corrections, which I don't really understand yet, but I'm assuming is just about why, the experiences of Indigenous peoples in prisons and why there are so many Indigenous peoples in prisons. So they essentially asked me if I want to take a look at this and update it with current data and theories from a decolonial lens, or however you want to phrase it. I'm always skeptical of anti-racist trainings in like big corporate and institutional settings, but I feel like this is at least something I can do to hopefully incorporate contemporary theory and sociology and language into these kinds of training programs. So we'll see how that goes. And I guess I'm still on the University of Alberta Prison Project. We're hopefully going to be continuing our research there, and then I have other work just on Canadian racism and nationalism. I do work on right-wing extremist movements and the far right, and big part of that, I think, is drawing attention to the fact that Canadian culture and Canadian society generally just likes to disavow that racism is a problem in this country. So a big part of my work on right-wing groups is dedicated to showing how right-wing groups are not as deviant as we think. They are actually part and parcel of Canadian culture, and we need to acknowledge that racism is not separate from Canadian culture, but actually a part of it. So that's the other work I do. And I guess I just moved to London, Ontario, so I'm trying to establish connections with Indigenous groups here. And start a TRC calls to action committee in the sociology department. But that's still in early stages. So I'm just kind of learning about the city, but it's kind of hard to do in a pandemic. So we'll see how that pans out.
I think we're wrapping up. Is there anything that either one of you wanted to add about sort of the topics we've covered, or things we haven't covered, or your own sort of initiatives?
I don't have anything else to add, I don't think.
Okay. Well, that was fantastic. I appreciate it. And thanks to both.
Thank you so much for joining us for this conversation. Once again, you can subscribe to the podcast on Apple Podcasts, Google Podcasts, Amazon Music, and most other places that podcasts are found. If you're in the Apple Podcast Store, give us a nice 5-star rating. It helps with the search algorithm. And remember to follow us on social media. Twitter, it's at @CCR_U of A, and subscribe to our YouTube channel, youtube.com/C/Center for Criminological Research, and like our videos and subscribe. Thank you very much, and we hope you'll join us for the next one.